Hey everybody, welcome back to the show. We have Kelley McBride, Public Information Officer with the Madison County Health Department. Welcome, Kelley.
Hello. Always good to be with you all.
Kelley, it's so nice to have you with us this evening. And we know that this is a special month nationwide. It is American Heart Month. And perhaps you can tell us a little bit more about that.
That's right, Colleen. And this is the perfect time to learn about your risk for heart disease and all the steps that you might need to take now to help your heart. So we are promoting American Heart Month along with the CDC and the American Heart Association.
Excellent. I was telling Colleen earlier in the week, I just got American Heart Month because it's Valentine's Day with the heart. I just put those two and two together.
Very good, Randy.
I'm a little slow.
This was an off-camera conversation. It did happen. I will back you up on that. Kelley, so tell us some of the steps, some of the markers. What do we need to be thinking about and considering right now?
Well, as we are learning, heart disease can happen at any age. And it doesn't just happen to older adults, it's happening to younger adults more and more. It's partly because the conditions that lead to heart disease are happening at younger ages.
Right.
So, high rates of obesity and high blood pressure among younger people, even in their 30s and 40s, are putting them at risk for heart disease earlier in life. And something I learned in my research here, nearly half of all Americans have at least one of the top three risk factors for heart disease.
Wow.
And that's high blood pressure, high cholesterol, and smoking.
Kelley, perhaps you already just briefly spoke on these, but I know the CDC, its guidelines, recommendations when it comes to heart disease. And with that, there is a series of myths, perhaps top 10 myths. What are some of those? What are some of the myths that maybe we need to overcome as we are becoming educated?
Right. The American Heart Association at heart.org has listed some top 10 myths about cardiovascular disease. And I thought folks could look those up for themselves.
Excellent.
But that we might talk about a couple of them.
Okay.
And so something that they pose is, how much do you really know about your heart health? It's easy to be fooled by misconceptions, and we think sometimes that's just for our older uncle who eats Big Macs all the time,
Sure,
or
right.
for somebody who's maybe not in good health. But so they have listed some top 10 myths, and the first one is, I'm too young to worry about heart disease. And as we've talked about, 1 in 3 Americans has cardiovascular disease, and not all of them are senior citizens.
Right.
So
right.
even people in their 30s and 40s can develop heart problems, and obesity, type 2 diabetes, and other risk factors are becoming more common at a younger age. So, and later on, there's another one about diabetes that I will get to. The second one is, I would know if I had high blood pressure because there would be warning signs.
True.
And so we have probably heard high blood pressure being referred to as a silent killer because you don't know that you have it, and you may never experience those signs and symptoms. So it's good to know, check in with your primary care physician, your trusted healthcare provider, to check that blood pressure and to learn how to check your own blood pressure maybe at home as well.
Cool. Nice. Okay. Excellent.
The third myth is, I'll know when I'm having a heart attack because I'll have chest pains.
Sure.
Well,
right.
not necessarily. It's common for those chest pains to be there, or discomfort, but a heart attack may have subtle symptoms. So you could have shortness of breath, feeling lightheaded, pain or discomfort in one or both of your arms, but not necessarily so. But even if you're not sure it's a heart attack, you should call 911 immediately if you
Right.
are experiencing any of those
Absolutely.
symptoms.
Absolutely. And all of those top 10 myths can be found at heart.org, correct?
That is correct.
Excellent.
So the last thing I'll touch on today is about diabetes. The number 4 myth is diabetes won't threaten my heart as long as I take my medication. So even when your blood sugar levels are under control and you're taking your meds for diabetes,
Right.
you are still at increased risk for heart disease and
Okay.
stroke. Because diabetes increases the risk of developing coronary heart disease. People with diabetes are 4 times more likely to suffer from heart disease than people who don't have diabetes.
Oh, okay.
So, yeah.
Okay.
And speaking of diabetes, Madison
Yes.
County Health Department has wonderful certified diabetes educators who can answer your questions about diabetes and can teach you about healthy living with diabetes. And in fact, we've recently had some classes that were offered via Zoom, and they were popular, they were
Excellent.
successful. So we are going to be offering more of those in the future.
That's fantastic.
But those are to be announced. We're
Right.
looking forward to announcing when those next classes will be.
Hey, Kelley, thanks for coming on the show. And for more information, where can everybody get this information? I know you have a couple of great websites.
Sure. As always, our website is MadisonCountyHealthDEPT.org. You can call us at 623-7312 or follow us on Facebook, Twitter, and Instagram.
Absolutely. Thanks, Kelley, for coming on the show today.
Sure, my pleasure.